Good evening and welcome to this evening's virtual event. I'm Tony Rutherford. I'm the Medical Director at Care Fertility in Leeds. We're one of the newest clinics to join Care. There are care clinics throughout the United Kingdom. We're the largest provider of IVF services in the UK. And you can see geographically that they're spread throughout the country. We're also one of the largest providers of donor eggs, which is what we're talking about tonight. There are a number of reasons why you might need donor eggs. Predominantly, it's age-related. As a woman gets older, the number of eggs available and the quality of those eggs decreases. And this is particularly pertinent over the age of 40, where there's quite a rapid decline in the chance of getting pregnant with your own eggs. For example, at the age of 40, the average chance of getting a pregnancy is 25%. By the time you're 42, it's 14%. And by the time you get to 44, it's only 6%. At 45, it's 1.9%. And above 45, it's 0.5%. However, if you use donor eggs, your chance of getting pregnant is the same as that of as the age of the donor. And in care, the chance of getting a live birth following egg donation is between 43 to 45%, which is really much, much better. Another reason why you might need donor eggs is some women under the age of 40 also may have an early menopause, or it's more commonly called premature ovarian insufficiency. There are some genetic conditions also that can affect and have a negative impact on infertility. And so using donor eggs can bypass this issue. And of course, nowadays, there are many types of family, and certainly same-sex male couples would need donor eggs to take as part of the surrogacy arrangement to give them the chance to have a family. So why choose Care for egg donation? Well, first of all, Care provides more egg donation than any other clinic in the UK. We have one of the leading egg banks in Europe. We have lots of donors available, and the real advantage is the length of time it takes to get you into treatment. When I used to work at Leeds Fertility, before Care, we had a waiting list of over 12 to 18 months before we could offer you realistically egg donation due to the shortage of egg donors. Here, we've got a bank of frozen eggs in our egg bank, which means that you can have a choice of egg donor and you can get started in your treatment within realistically 3 months to sort out the logistic arrangements. We have lots of donors waiting and available. You can have a look at our egg bank and make your own choice to match your own physical characteristics. We have a dedicated and personalized patient care and support team, as I'll come on to in a minute. You've got a choice of either using frozen eggs from the egg bank, or for some couples prefer to use fresh eggs, and we can certainly accommodate that too. Some people would like to use a family friend or a relative for egg donation. That's something that we can do at Care too. It is very cost effective, and we have a transparent pricing structure. So it's very clear, and we have our Care Pals team who can give you very accurate information on exactly how much the treatment would cost. All this treatment takes place within the UK with donors sourced in the UK, which stops any of the uncertainty of having treatment abroad. The donors are all altruistic, which means that they have decided to donate for the benefit of others. And the success rates are with Care are certainly as good as anywhere else in the country, if not better. So our donation team, we have a central donation team of specialists, nurses, midwives, administrators and consultants, all of whom are trained to streamline care for anybody thinking about having treatment with donor eggs. And the advantage of having this team is that they are able to help people with that degree of expertise all over the country. They have been working and supporting patients for over 20 years as part of the care setup. We can give you detailed costings for all the treatment options. We can answer any questions and concerns that you may have. And you know, it is a big decision to decide to use donor eggs. And our team here is here to support you and guide you through the whole process. And they know what they're talking about. They're real experts in their field. And if they can't answer that question themselves, they know somebody who can within our organization. So what do you choose? Frozen egg donation or fresh egg donation? Well, the advantage of having the frozen egg donation is it means that we've got a large bank of eggs which are divided up into sets, and you can either have a standard set of 6 to 9 eggs or a large set of 9 to 12 eggs. And these eggs can then be thawed at your convenience and fertilized with your partner sperm or with donor sperm, and they can be cultured in our laboratories, and then once the embryos are ready for transfer, they'll be transferred into your womb or uterus. With fresh egg donation, we will help to match you with a suitable donor. Sometimes fresh egg donation takes slightly longer. The clinic close to which you live can synchronize your chosen donor's treatment, and when the donor eggs are collected, they're then fertilized again with your partner or donor sperm, cultured in the laboratories, and then when they're ready for transfer. Usually the transfers are performed at the blastocyst stage of development, which is at day 5. So why can we now offer donor eggs, and why wasn't this done in the past? Well, the main advantage is vitrification, which is a rapid freezing process, which has radicalized the use of frozen eggs, because you get the same sort of success rates as we would in the past have expected from fresh eggs. Over 85% of eggs in the egg bank will survive the freeze-thaw process. We tend to, I'll talk you on a little bit further about that, and the process that we have to adapt because of the vitrification process. We need to fertilize the eggs with ICSI, and I'll show you that in a little minute. So the frozen egg bank will enable you to select your donor online, and then you can have your treatment in one of the local clinics. So if you wanted to have egg donation in Bath or Leeds or Sheffield, we can still provide those eggs in your local clinic. We can arrange to thaw and fertilize the donor eggs in sync with your own cycle and a time that's convenient for you. So it's not relying on 2 people, rather than the donor to take into consideration as well as yourself. IVF using fresh donated eggs needs a little bit more coordination, because there are 2 people involved in this. We have to get the donor ready, and she has to go through the IVF process, and then we need to sync that with your own menstrual cycle, so we make sure that the embryos can go back at the right time. Embryos, there is a relatively short period of time in each cycle where we can replace the embryos. We need to make sure that you and your donor are matched. So let's talk about the preparing you for the transfer. So the first step in creating your embryos is warming the eggs from the freezer under carefully controlled conditions. And because the freezing process can harden the eggshell around the outside of the egg, we use ICSI to fertilize the eggs. And we're just going to watch a short video presentation of the ICSI process now. So here you can see the egg cell. It's held in a particular position. And you can see that there's a little sperm in that glass pipette. You suck up the membrane and then it pops it, and you put the sperm, there it goes, into the egg cell. It's amazing to think that that works. But it's a very effective method of fertilization with a similar chance of fertilization as natural insemination. And over 70% of eggs will fertilize. The fertilized eggs are then cultured in the laboratory for up to 6 days. And we have some incredibly clever incubators now, all time-lapse imaging incubators, that monitor the growth of these embryos, and they take snapshots every 10 minutes of the embryo's development. Why is this important? Because it allows us to look at and see whether the embryo actually reaches its milestones in the different stages of development. And we use 7 key milestones in the embryo's development to be able to score which will be the best embryo to give you a chance of a successful pregnancy. And you can just see the blastocyst here hatching. So if we're going to prepare you for your transfer, so we need to give you medication to get you ready. And in most cases, we'll give you estrogen tablets to thicken the lining of the womb, known as the endometrium. And most women will need about 12 days of estrogen. We then do a scan to measure the endometrial thickness. The ideal thickness is anything from between 9 to 13 millimeters, but pregnancies will occur from as low as 6 up to around about 16 to 17 millimeters across. Once we are happy that the endometrium is appropriately thickened, we then give you some pessaries, some cyclogest pessaries, and that's progesterone. If you can imagine the estrogen tablets a bit like the builder, it puts the structure up. Then the progesterone is the fitter. It comes on, puts the electric in, puts the heating in, puts the water in, makes the endometrium an appropriate place to put an embryo. And then we replace the embryo at the appropriate time in what we term the window of implantation, the exact time, which gives the embryo the best chance of implanting in your uterus. So the embryo transfer is very straightforward. On the day of the embryo transfer, we select the best embryo to go back, the one with the highest score and the one that looks normal, and that is transferred into your uterus using a small catheter. It's like having a speculum for a smear test, but on this occasion you've got a full bladder, so it can be a little bit uncomfortable. We only put one embryo back at a time, because you're built to carry a singleton pregnancy. And the reason why we put one embryo back at a time is that if you have a twin pregnancy, there are increased risks, both for you and the baby. And therefore it's better when we're creating a pregnancy to make it safer for you, one at a time, so you have a healthy pregnancy and a healthy baby. Now then, of course, these treatments can be expensive. You can get egg donation on the NHS if you fulfill the eligibility criteria. However, there are, if you are not eligible for NHS funding, and many women over the age of 40 are not, then we have got financial packages that you can use, and our Care Pal team and Care can talk to you about the care pay options available. And you can also pick up a brochure at one of our clinics, as well as phoning the care pay team on the number that you can see on your screen. So there's some questions which people commonly ask about egg donation. They said, how many people can my donor donate to? Well, in the UK, it's regulated by the Human Fertilisation and Embryo Authority, and you can have a maximum of 10 families in the United Kingdom. So what information can my donor find out? Donors can contact the HFEA or the clinic they donated to, and they can inquire if any live births have followed their donation. We can tell them the number of live births, the sex of the children born, and the years of the birth, but we cannot give them any of your details. Now, in the UK, in 2005, they removed anonymity for the children conceived through donation. This is the first year where potentially children conceived through both sperm and egg donation could find some information out about their donor. So when a child is aged 18, they can access the HFE donor register and they can be given identifying information about their donor. This will be their name, their date of birth, and their address at the time of donation. We do not know at this point in time how many donors, conceived children, will try and find their genetic parent at all. And it's only with research over the coming years will we understand this situation. So how do you get started on your egg donation journey? Well, you can, a new patient inquiry team, telephone numbers on the slide there, or you can get in touch by email at carefertility.com and get in touch with our team, and they can then select out which is going to be the best clinic close to where you live for you to have your treatment. So I'm free now just to answer any questions that you have. We've had a number of questions come through, and the first question is, I'm 43. Do I have a chance with my own eggs, or is donor eggs likely to be the best option for me? In answer to that question, at the age of 43, it's likely that your chance of having a live birth is going to be around 7 to 8%, maybe up to 10%. Your chance of getting pregnant with donor eggs is going to be 4 times greater than that at 43%. So donor eggs will give you a much better chance. Could you opt to have further tests before an embryo transfer to check for potential implantation issues? You can, but implantation issues are not really the problem when you're aged 43. The main issue is really the egg problem. If you're having egg donation treatment and you've had previous unsuccessful IVF treatment, and some couples after a number of attempts using their own eggs may decide to move on to donor eggs, there are some tests that we can do that will examine the endometrium to see if there are any factors that are affecting your chances of success. There is a test known as the endometrio test, which looks at the window of implantation, and it's very precise for you. We know that about 67% of women, it's about 120 hours after you start the progesterone. But we do know that in 29%, it's a little sooner than that. And we know in 5%, it's a little later than that. And by doing the transfer exactly the right time, we can increase the overall live birth rate by about 10% for that one transfer. And if you look at all the embryos created in that one cycle, and about 30 to 40% of women will have spare embryos available, the overall cumulative conception rate, putting all the embryos back, is increased by over 20%. So it's certainly something to consider. Another thing that you can check, and sometimes is the cause of a implantation failure, is what's called the endometrial microbiome. It means the bugs in your genital tract. And naturally, in the genital tract, there's a bug called lactobacillus. It uses the glycogen secreted by the vaginal wall cells to make lactic acid. And that creates an acid environment in the vagina, which stops any pathogenic, abnormal bacteria growing. However, in some women, those defense mechanisms are a little bit lacking, maybe due to immune problems, maybe due to hormonal problems. And in those cases, sometimes you can get an overgrowth of bugs in the vagina, which could be potentially harmful and can cause a chronic low-grade inflammation. And so in those cases, we can give you specific antibiotics to treat that, and then some vaginal probiotics to provide back those friendly lactobacillus bacteria to strengthen the defense mechanisms. Now, another question that's come up there, is there a success rate difference between fresh and frozen eggs? Nowadays, there's almost no difference between fresh and frozen eggs. So it's, the chances of getting pregnant with either are about the same. Can we have a double transfer with donor eggs? Well, we as clinics have a legal responsibility to reduce the number of multiple births in the UK. And the reason for this is 1 in 12 couples that have a twin pregnancy would have a dead or handicapped baby. Clearly, we want to help you as a fertility clinic in having a healthy child. So if we're using an egg from a young donor, then the risks of multiple pregnancy are significantly increased if we put back more than 1 embryo. So for egg donation, we only put 1 embryo back at a time. The treatment is, there's another question here, is there a difference in success rates between treatment in the UK and abroad? I think the differences between treatment in the UK and abroad is that we are very regulated. We know where all the donors have come from. We know they've been appropriately screened, appropriately tested. So we know that it is safe for you going forward. So that's one of the reasons why I would stay in the UK for your egg donation treatment. In the past, as I said, there was long waiting times, but there's no point going abroad if we can get you treated within 3 months. Another question here is, do you need sedation for the embryo transfer? Most women don't need sedation for an embryo transfer. It is a procedure like a smear test. Many clinics can provide some help if you do need it at the time of the embryo transfer. And certainly in Leeds, we can provide sedation at the time of the transfer, but it's only a very small proportion of women who actually need it. In most, they find it a very straightforward procedure. I think the most uncomfortable thing is having a full bladder and somebody putting an ultrasound probe on your tummy. What characteristics are available on the egg bank is the next question. We have a wide range of donors on the egg bank, and most of the egg donors will be Caucasian in origin, as is the population in our UK. The number of ethnic mix of donors tends to mirror the population statistics in the UK. There is not as many Asian donors as there are in our population, and some of that is because of the religious restrictions with egg donation in certain ethnic groups. And we've got another question that's come up here. I had 14 embryos transferred, 2 resulting chemical pregnancies. Is donor eggs the way forward? You've had lots of tests done, all normal apart from high natural killer cells. Started IVF at the age of 34 and I'm now 39. Now, I certainly think that you've got a better chance of a success with donor eggs. It depends on the quality of the embryos that are transferred, and it depends on whether you've had treatment for the high natural killer cells. There is specific treatments that can be done to lower the natural killer cells. There is research ongoing at the moment to actually look at the impact of interventions like the use of steroids to see to try and quantify the sort of difference it might make to your chance of success. But by changing either the egg or the sperm, you are creating a new embryo, which is different. And certainly egg donation may be a help for you. But realistically, you'd need, as a doctor, to know the whole story and working out whether this would be the best thing for you. Would you do a dummy test before ICSI to check the thickening of the dummy run test before ICSI to check the thickening of the lining? Generally speaking, we don't do a dummy run of hormones to check the lining of the womb unless you're having the endometrio test, because what we do with the endometrio test is we do the biopsy of the endometrium in a hormone cycling using exactly the same medications as we're going to use in your fresh cycle, and we can see how thick the endometrium develops in that. We then take the biopsy. Once we get the answer, we can then work out which is the best time to do the embryo transfer. But in most cases, we wouldn't normally do a dummy run unless you stopped having your period some time ago, and we're going to start you on some hormone replacement therapy to get the uterus used to having hormones again, just to make sure that it can thicken normally. So we would do a baseline scan around about day 12 under those circumstances. Are there any other questions? What's the upper age limit of doing IVF with donation? That does depend. There are some clinic variations. Care will offer egg donation up to the age of 54. I think that the number of the age at which you have egg donation will vary from clinic to clinic. Different doctors have different views on it. The American Society of Reproductive Medicine looked at the impact of having a pregnancy in your 50s and certainly recommended that we shouldn't really be performing egg donation above the age of 54. Personally, I think that probably 50 is safe, and most of the patients that we see would be having egg donation under the age of 50. You have to think about the risks that as you get older, egg donation actually it is more risky to carry a pregnancy. There's a higher risk of the placenta not working as well, increased risk of blood pressure in pregnancy, increased risk of gestational diabetes in pregnancy. So I think one has to be cognizant of these facts when making that decision. If you were around 50 and wanted to consider egg donation, we would have to do a full medical assessment to make sure that you were fit enough and didn't have any coexisting medical conditions that might hinder you having treatment. Okay, I think that's going to be the last question now. So I hope you have enjoyed this presentation. I hope it's been helpful, and we look forward to seeing you at CARE in the near future. Good evening.